I'm Tsogoo, and I'll be presenting on my study, Multicultural Training Experiences of Graduate Students Working with Clients Language Other Than English, otherwise as I will be referring to as LOE. I'm particularly interested in LOE population as I am a first-generation immigrant and English was my second language. I'm also really passionate about social justice issues pertaining to this population, and having prior knowledge of the health disparities within BIPOC and marginalized communities and how language can be a barrier to seeking mental health treatment, I was curious about the best practices, guidelines, or standardizations with this population. And upon my literature review, I really did find that there was a gap and a lack of standardized guidelines on how to deliver mental health services to LOE population effectively. This also really made me curious about the graduate students' experience and what type of training that they are receiving within various settings. So this really guided my research questions. What are future clinicians or graduate students' training experiences preparing them to work with this population, how that training was conducted, and in what context did that occur, and then what are their perceived barriers or successes in their training. And to really understand and get in-depth information about this, I use a transcendental phenomenological approach to capture their lived experiences and really get more rich data. And so my sampling strategies were purposeful, homogeneous, as I was looking for specifically graduate students who have received any training experiences for working with this population. I ended up with 5 participants in total. Students from the Chicago School were recruited. They participated in an open-ended semi-structural one-time interview that lasted anywhere from 30 to 60 minutes. And upon the interviews, I did a transcribing process. And I really focused in on bracketing myself out of it, as I have experience as a past member of the LOE population as well as being a graduate student. And so I grounded my thematic analysis really using Mastaka's phenomenological approach to really capture the textual or the what and the structural or the how participants experience their training. And I ended up with 5 participants. They were all women, ages from 5 to 28 years old, and they were a part of various practicum settings ranging from community mental health, private practice, correctional facility, inpatient psychiatric, and academic medical centers. And through the thematic analysis, 7 distinct themes emerged. Those are brief guidance, practicum site context, third person in the session, self-reflections, successes, barriers, and wishes for future training. Most participants describe their training to work with LOE population as informal, very brief, and minimal amount of guidance. And as a result of this, in their self-reflections, most participants endorsed feeling anxious and having that imposter syndrome following their interactions. And this also includes 2 of the participants who are bilingual who carried out bilingual therapy as well. Some sites provided site-specific guidance, for example, no using ad hoc interpretation, while others did not impose any guidelines. Most participants that utilized interpreter in session noted that the interpreter really impacted the dynamic that they had with their patients and interfered with their approach to clinical work. Some also questioned the quality of the interpretation, really wondering if the interpreter had insight into psychological concepts, and some even called concern to ethical concerns such as confidentiality. Most participants noted successes to be the interactions and support they got from their supervisors, didactics they learned throughout. Some barriers were that lack of training, and that really tied into their wishes for future training and having a more structuralized training process. This study is not generalizable, as it does not represent the experience of all graduate students in their training experiences. I think overall the study really highlights the systemic and structural inequities within various training programs and institutions. I think there really is an absence of clear standardized guidelines for those who work with LOE population, and it really does contribute to the prolongation of health disparities for marginalized communities who infrequently seek mental health care. I think there is a need for guidelines for monolingual and bilingual clinicians to engage in ethical and culturally reflexive work with the linguistically and culturally diverse population. Thank you so much for listening.